Okay, guys, so this is going to be the sciatic nerve glide. This is one that I personally use a lot with both myself and people I work with. Almost everyone has had some form of sciatic issue. If you haven't, that is great, and I hope you never do. But most people do, and you can characterize that sciatic issue by sort of that shooting, tingling, lightning, burning feeling anywhere from your back down through your butt, into your hamstring, into your calf, anywhere in that area. So anytime you think like, oh, like shooting pain, we're talking about a nerve issue. So now with this one, what you're going to be doing is actually gliding the nerve. And so with this nerve glide, you will be lengthening the nerve into its longest state, and then you're going to very gently glide it back and forth. And this is going to help bring stimulation to the nerve, as well as help re-stimulate that area in a way that lets it relax the muscles around it. And so that way we can get relief through the entire nerve line from the back down to the heel.
Okay, so when we perform the sciatic nerve glide, it's going to look a little bit different for everybody. There's a couple underlying rules I want you to just remember right away, and I'm going to continually repeat these because it's very important when you start actually manipulating nerves. The first one is going to be to not go past the threshold with which you should have the feeling of the nerve being stretched. So what I mean by that is, as we're going through this, you're looking for a very mild intensity. You are not looking for a more is better kind of thing, okay? So we are looking for what I would consider to be a 3 or 4 out of 10 tension in the nerve itself, okay? The other thing that's important to note is everyone will begin to drive the movement, and when I say drive the movement, I just mean add the moving piece to it at a different place in the progression, and you will just go with the part that is relevant to you. Don't keep adding on if it is no longer relevant, okay? And I'll be very clear about that as we're going. I just want you to sort of know that up front. So you may be doing it at a different place in time than someone else's, and that's totally fine. Okay, so our sciatic nerve runs from the heel up through the calf, up through the hamstring, up through the glute, into the low back. So when we're looking for tension, you will find it anywhere along that nerve line, okay? The tension, when we're thinking about nerves, if you've ever felt sciatic nerve pain, you already know what the nerve feels like, but we're basically looking for anything you would describe as like a buzzing, a tingling, a radiating, shooting, electric, all of those adjectives would describe how a nerve feels. So like as we're going to begin the movement and stuff, if you're like, oh, I actually feel a little bit of a buzzing now right in behind my calf, you have found it. That is what we have done. We have now lengthened the nerve. One thing to note as well is with the lower body, a nerve glide is going to be a very diffused tension. If we were to do a nerve glide in the upper body, it is a very, very distinct nerve tension, meaning if I was doing something with my fingers up to my shoulder, I would feel the fingers buzz right away. Whereas with the lower body, you may feel like you can't pinpoint where it is. It's just in a general area, and that is normal. So when I do this personally, I feel a very diffused buzzing between my upper calf and my lower hamstring. So don't feel like it needs to be perfect. The idea is not more is better though, okay? So when we begin, you're gonna sit, and you'll always do both sides. Nerves are kind of unique where they actually are all connected. So even if you feel right side nerve issues, it will be to your benefit to also do the left side, because many, many times I find the left side or the opposing side will actually help alleviate more tension than the side in question. So to begin, we're going to start with our legs straight. The other leg can just be set down for balance, however you'd like it. The leg is going to be straight, and I'm going to pull the toes towards me, okay? My knee is locked out, and I'm going to sit up nice and tall so I'm postured. If you are very, very tight, it is possible that you actually have now found a 3 out of 10 tension just by lengthening your spine. If that is you, it is okay. What you'll do now is actually drive the movement from here. So what you're going to do to drive the movement is just tilt yourself forward and backwards just a little bit while keeping the leg exactly as it is. And it should just feel like you're grabbing and releasing softly on that tension, okay? If you have not found the 3 out of 10, then we're going to keep adding pieces to it. So now from here, we're going to hinge forward at the waist while keeping the chest nice and tall. So I stay tall through here, and I lean forward at the waist, okay? So now I should feel a little bit of hamstring stretch, but I may now also have that 3 out of 10. If you do, you can now repeat that last step, coming from straight up to leaning forward, and we can grab and release on that nerve. If you have not found your 3 out of 10 yet, then you're just going to come forward to where you were, hold that position, and now we add spinal flexion. So what we're going to do is start at the neck and curve. If we still don't have it, then we're going to keep going. If you do have it, repeat that last movement. So you're always just adding on the last movement. So if I didn't have it, I'm going to go neck and upper back. Now if I have it, I add to there, upper back. Okay, if I don't have it still, I just keep bending forward until I find it. So for me personally, right about here, I now have a good 3 out of 10 tension in the back of my upper calf, running into my hamstring, and I'm going to repeat that last step. So I'm grabbing and releasing on the nerve. I like to do about 5 to 10, but there's no wrong amount. Just remember, 3 out of 10 tension, more is not better, okay? And then you can shake that out and see how it feels. And remember, we will always do both sides, okay? So what we just did, you can now apply that to your second side.